David, we're going to start with the Santé Quebec story. I actually had someone on earlier in the show, one of the specialists, one of the medical specialists, who's trying to understand what the government is doing by telling it that, and I think the comment from Christian Dubé was, we don't need them to tell us how to manage the system, when in fact they're the ones who say, wait a sec, you have a 90,000 patient waiting list. Shouldn't we have some input here? So what do you think? And what was the motion today by the PQ? What are they asking Christian Dubé to do?
Well, what the PQ is asking Christian Dubé to do is actually be transparent on the cuts that Christian Dubé has asked the system to make. We know that Santé Quebec, the new agency that's now supposed to run basically the healthcare system since December 1st, has been tasked by Christian Dubé to find $1.5 billion in the system. But we have no understanding of where or how these cuts are going to be made. And Paul Saint-Pierre Plamondon is coming out since the session ended in Quebec City on Friday. We're kind of in a kind of media lull until the actual beginning of the holidays, right? For the next 2 weeks, we're still around. Everybody's pretty much around and working. And so Paul Saint-Pierre Plamondon, very astutely, here he is on a Tuesday, getting in front of media and getting on the media about healthcare and trying to score points this way. And so on top of this very interesting investigative reporting piece by La Presse today on Clic Santé, the fact is that while the government says, no, this is not austerity, and remember when the CAQ was in the opposition, they would harp on us when I was in government on what we tried to call, budgetary restraint and discipline. They called it austerity, and it stuck, and it hurt the Liberals in the 2018 election. Well, here we go again with an $11 billion deficit. No matter what you do, Aaron, every January 1st or April 1st, if you're looking at it from a government financial year perspective, healthcare costs are going to rise between 6 and 8%. Even if you don't do anything, if you don't buy anything, if you don't add any special programs. And so it's over 50% of our budget already. It's going to go up no matter what, and we simply do not have the money. So Paul Saint-Pierre Plamondon is saying, okay, so be transparent. Where are you going to cut? Because Christian Dubé says, oh, there's some fat in the red tape and the administrative side of things. Okay, where is it? Because right now what we're hearing from certain regional health centers and some people, under the radar, off the record, they're saying that actually services are going to be affected. And it's the old song, when governments start talking about cutting, they say, oh, but services won't be affected. And what Christian Dubé is saying right now, so Paul Saint-Pierre Plamondon is saying, fine, tell us where you're going to find the $1.5 billion. So it's calling out the minister on that, and good luck getting a response.
By the way, with this idea now, I heard this morning as well, this idea of sort of revamping Clic Santé. Didn't we spend like $70 million building this in the first place? Why does it need a revamp?
We spent $77 billion, to be exact, since the pandemic. And just FYI also, this was and still is a no-bid contract. This is given to one company, a private company, out of Saguenay-Lac-Saint-Jean. And you can understand this was set up during the pandemic. So you can understand emergency and having to move very fast. So a lot of no-bid contracts were given at that time. But now we're out of the pandemic, and we're still giving no-bid contracts to this company. And what the La Presse investigative report says is that it's stunning. We're looking at almost 8 out of 10 or 7 out of 10, depending on the type of appointment you want to book. 7 to 8 out of all the appointments are directed towards the private sector. And actually, after that, it goes to the pharmacist. I mean, the public sector has almost nothing. Mm-hmm. So the question that this report raises is that, well, is Clic Santé ultimately a tool to direct people to the private sector? instead of really trying to find spots in the public sector. And so we invested a lot of money to develop this, and now Christian Dubé reacting to this report from La Presse to say, well, we have to centralize everything and we have to find ways to make sure, because there's a lot of different ways for people to get appointments. So we're going to work on centralizing all of this. But ultimately, this was a way to have an inexpensive way to help people. So on the one hand, he says we have to do better, but on the other hand, he's saying, oh, this was the best way we could do this. So he's kind of stuck. But at the end of the day, Aaron, the fact is, no matter how you look at it, the bigger question is that as Quebec's population gets older, there is just no way right now, with the way Quebec's economy is generating money, that we can maintain this system we've built since the 1970s. There's just no way. And so you can see, and we went through this with my former colleague Gaétan Barrette. That didn't work. Then we had Danielle McCann. That didn't work. And here we have Christian Dubé, who is talking about refoundation of the system, and he won't even be there to actually see it through completely, because he's already announced that he's not running again, so he's kind of a lame duck minister, and who knows if François Legault will keep him till the 26th election as healthcare minister. But the idea here is that no matter how you look at it, unless the Quebec government finds a way to get more money into the system, there is no alternative but to go private and to transition towards private and have a bigger role to play with private. Now, I understand the debates. I understand the reservations of everybody doing this, and I know it's a sacred cow. But I remember back in the Charest government days, remember when Finance Minister Raymond Bachand tried it for 1 year to add a $250 price tag for people who could afford it, for people who, I think it was over $100,000 a year, and it was in your income tax report. You had to pay an extra $250. That lasted a year because the public resentment was so massive. And so right now, there's just no way to face this with the fact that we don't have the human resources. My example, it's still good. The mega hospital in Vaudreuil that is set to open in 2026, Aaron, 4,800 positions, and the healthcare ministry does not know how these positions are going to be filled without taking staff away from Montreal area hospitals. So, I mean, at the end of the day, we're going to have to change the conversation, or else we're going to keep having these conversations that ultimately are leading us collectively towards a wall.
You know, the way you laid out, David, I'd say I don't even know who would take. First of all, who would want this job, given the fact that it's gone from government to government to government, and we're unable to get this thing even close to being right. It's pretty grim.
It is grim, but we're collective. I think we're collectively responsible also for everybody going towards this wall, because, Aaron, nobody wants to give an inch. We don't want to, we collectively do not want to reopen the collective bargaining agreement. Mm-hmm. We collectively do not want to pay more. We collectively do not want to look at ways for Quebec's economy to actually grow significantly the types of revenues that we will have no choice to generate. The richer portions of our population is not willing to give up the universal access to this. Imagine if, for example, do we still, one of the sacred principles of our society in Quebec and in Canada is universal access to health care. Now, if somebody is making over $250,000 a year, does that person, or 300 or 400, whatever, does that person necessarily needs to have a free access to health care? maybe
Right.
not. Maybe
Right.
that person could pay more. I'm
Yeah.
not giving you that exact solution, but I'm
But
just
that
saying,
scenario, yeah, understood.
we need to look at this completely differently. We're trying to look at healthcare as we did in the 80s and 90s, and it's just not the same thing. The largest segment of population is entering a phase in their lives where they're going to need the most health care, and we know we don't have the bodies to do the work, and we don't have the resources, the financial resources, to pay these people to do the work. So something's going to have to give, and the politicians keep serving us the same types of solutions, and it's like the hot potato, or rather, wrong metaphor. I'll pick musical chairs. Each government is hoping that the fatal break won't happen on their watch. But unless we have this crisis that will force us to look at this completely differently, and beyond healthcare, how Quebec's economy is going to have to transform, how our tax system is going to have to transform itself, so we can generate the type of revenues and structures that will allow us to create a new balance between public healthcare system and private healthcare system, we're going to keep having these very grim and dire conversations.
And that's where we will leave it. David, thank you. Appreciate it.